Hi, it's Nathan from I Need IVF, and today I'm here to talk to you about our essential guide to male factor infertility. So, what is male factor infertility? Well, there's a clinical description for it, which is a little bit dry, but essentially it is anyone who has one or more abnormality in their semen analysis and or the presence of inadequate sexual or ejaculatory function who haven't managed natural conception within 12 months of trying. This description comes from the World Health Organization. Infertility in men is very, very common. Of couples trying, about 30% of those diagnoses are male. The other 15% of them are both, and 25% of them are unexplained. One really interesting thing is there was a detailed literature review performed by Kumar and Singh, and it produced some really interesting results. It estimated that between 60 and 80 million people worldwide suffer with infertility. This is between 8 and 12% of all couples are actually impacted. Fertility rates in men under 30 has decreased by 15% between 2002 and 2010, and male factor infertility accounts for between 40 and 50% of all infertility cases in couples. Male factor infertility affects 7% of all men, and between 1998 and 2007, an analysis of just over 10,000 semen analyses found that sperm concentration was falling by 1.5% per year, that sperm motility is falling by 0.4% per year, and mobility by 5.3% per year. There are other studies that are actually demonstrating similar results as well. So not only do we have infertility, it actually appears to be getting worse. The research doesn't give a clear reason for it yet, but the most likely culprits, as it appears, are sort of social economic. So access to healthcare, lack of good quality diet, smoking, alcohol use, but also environmental issues such as increased pollutants and chemical exposures. So when I first read it, I was actually really shocked about it. But now that I think about it, it's actually reflecting our experiences. I've met a lot of men now who suffer with male factor infertility, and it is certainly on the increase. I mean, I was talking to my dad about this, and he barely even thought about male infertility about 50 years ago. So before we actually get a really good understanding of what male factor infertility is, we need to have a think about what a normal sperm is. So I'm going to put an image up on screen which shows a normal sperm. As you can see, it has a head. In the head, it contains something called the acrosome, which is a layer around the sort of top end of the head. Okay, this releases enzymes, other chemicals that help break down the external membrane of the egg, which is called the zona, which allows the sperm to get into the egg to help fertilize it. The head also contains a really important part called the nucleus, and this is where all the genetic information is contained. Now, a normal head should be between 2.5 to 3.5 micrometers wide and 5 to 6 micrometers long, so very small. As you move down the sperm, you'll see a little bit that looks a bit like a neck. This is sort of the mid piece. This is the energy center of the sperm. This is where sperm gets all of its energy. It contains something called mitochondria. These are basically organelles that have a reaction that creates energy, and it allows them to move and penetrate the egg zona. And problems with mitochondria can cause basically immobile sperm. The tail. So a normal tail basically creates a really cool like waveform. Have you ever seen a sine wave graph with an needle? It does that, and that's what propels the sperm through. And the tail should make up about 80% of the size of a sperm. So now that we understand what sperm are, what's semen, because they are different. Semen is effectively what contains the sperm. So it has the sperm, it also has enzymes, it has fluids, it has all kinds of chemicals, nutrition, has all these kind of things that basically allow the sperm to survive both within the testes but also as it comes out and into the lady, and it helps them get to the egg. So when this semen sample is actually analysed by a semen analysis, the World Health Organization has guidelines for what it dictates as a normal semen analysis. They are a volume greater than 1.5 millilitres, a sperm concentration of at least 15 million sperm per milliliter, and a total sperm count of 39 million sperm per ejaculate. You need about 58% of them to be live, and your normal forms, that's those that fit the description that we just discussed, needs to be around 4%. Progressive motility needs to be 32%, and your total motility, which is that progressive motility which allows it to move, and non-progressive motility, which are those that are moving but not forwards, has to be 40%. So when I had my semen sample, my first sample had really low normal forms but a really high count. By my second or third one, I got diagnosed with chronic prostatitis, and that absolutely killed my sperm count. It went down by 4 times, and my sperm, by some lifestyle changes and things I made, my sperm morphology, its normal forms, came up a little bit. So by the second one, we weren't actually sure whether my sperm would be able to fertilise an egg very well, so they weren't sure whether I'd need ICSI for our IVF treatment. What types of male factor infertility are there? We understand what's normal, but what is abnormal? There are a number of conditions that you can have. Azoospermia, that is a condition that affects about 2% of the population, and it essentially means the semen has absolutely no sperm at all. So that's quite a problematic one. You've got oligozoospermia. I will be pronouncing some of these wrong, so I apologise. This term has 2 meanings. First, it's to do with concentration, which if you have less than 15 million sperm per milliliter, and also whether you have less than 39 million per ejaculate. And it's estimated that about 30% of couples suffer with this one. You've also got a strange one, which is polyzoospermia, which is the complete opposite of the last one, where you have a concentration greater than 200 million sperm per milliliter. This doesn't always cause infertility, but essentially it means that the sperm have a challenge to actually move. This is something that can actually be solved through IUI, where they prepare the sample and reduce the concentration of sperm within a size. Next, we've got stenozoospermia, and this is actually the most common form of sperm problem, and it's a low number of motile sperm and a high number of sperm cells that aren't actually moving. This has a complete variety of, shall we say, severities, from where you get total, which affects about 1 in 5,000 people, and the sort of more moderate is becoming more and more common. One thing to note with this one is recent research has showed that DNA fragmentation is actually much more common in men who actually suffer with this one. And then we've got teratozoospermia. This is another pretty common problem, but it's actually a really difficult one to treat. And it's those sperm that don't have the normal morphology, so those that aren't shaped correctly. So you could have a really big head, you could have 2 heads, 2 tails, a spike, a long neck. You know, there's an awful lot of different types of morphological changes that a sperm can actually have. And couples with this often actually require ICSI in order to, if they go through IVF. I always imagine, because obviously I had really low normal forms, I had 2%. And I always used to like to imagine my sperm with 2 tails swimming in left-handed circles, which is pretty much how I imagined it. And then you've got a specific one, which is called globozoospermia. And that is effectively, it's a type of morphology, but it's quite an interesting one, because it's sperm that have a circular or a round head. And what happens is that something called the Golgi apparatus, it doesn't transform into the acrosome that we spoke about before, which means that those sperm actually can't penetrate the egg zona in order to actually fertilise them. So they're the sort of main factors that affect the actual sperm. There are some structural problems as well. So you get a swelling and a twisting of the veins that can run through the testes, and that's called a varicole. And what that does is it causes increased heat within the testicles, which means that the quality of them goes down, and it can impact fertility. You get ejaculation problems. You know, some people actually have issues with ejaculating through penetrative sex, but you also get a specific problem known as retrograde ejaculation, which is where the ejaculate enters the bladder rather than coming out of the penis. Some of these can be reversed, although not all, but the sperm can actually still be retrieved via surgical sperm extraction. Another one that is quite common, and you see a lot of people talking about it in male fertility support groups, is undescended testes. These are normally operated on in childhood, but they are very commonly associated with fertility problems later in life. And then the final main sort of physiological problem is blocked tubes. So there's lots of different tubes involved in sperm production. And a blockage in any one of these can actually have a serious impact in your ejaculate and sort of the fertility. And these aren't always as easy to treat as you might think. So they're the types of male infertility. Now we'll have a quick think about what actually causes infertility. So these can be broken down predominantly into medical and lifestyle. Now the medical ones are chromosomal defects. So things like cystic fibrosis can actually impact it. And some specific genetic conditions can actually prevent the development of male reproductive organs. The hormone balance, so you've got the hypothalamus, the pituitary, you've got the testicles. They are all involved in spermogenesis, which is the production of sperm. And a number of things can go wrong, an excess or a lack of luteinizing hormone, testosterone, estrogen. All of these things can actually lead to problems with sperm production. Infections, both chronic and current infections, so that can include sexually transmitted diseases, infections and inflammation of the prostate. All of these things can actually cause problems. And as I said, we actually saw a huge reduction in my sperm count when I got diagnosed with chronic prostatitis. You can also get certain autoimmune diseases that mean that you actually generate antibodies which attack the sperm, because those antibodies actually view the sperm as an invader, as it would when it's attacking a bacteria, when you've got a certain bacterial infection. Tumours, both cancerous and benign, they're quite common. When they impact hormone regulation, then they commonly impact fertility. Certain medications, so if you're on long-term steroid uses, chemotherapy, anti-epilepsy medicines, all of these things can have impacts on your fertility. Then we move on to sort of the environmental and the lifestyle. Now there is less evidence to prove these impact sperm, but there are certainly some, and what I've listed here are ones that have evidence. So substance misuse, alcohol, smoking, illegal drugs, all of those things impact your fertility. Psychological, so depression, severe anxiety and emotional stress, all impact sperm. Heat, sperm don't like heat at all. So it's just something, I'm not saying you don't have to have a bath ever, you don't have to go to a jacuzzi, but a lot of heat will certainly impact your sperm production. Being overweight or severely underweight affects your hormonal balance, which in turn can impact the production of your sperm. Exposure to harmful substances, so if you work with chemicals, heavy metals, ionizing radiation, you should be aware of that, because those things can impact your fertility. And then the final thing is your diet and your nutrition. If you're not getting enough of certain minerals, vitamins and metals, then that also impacts male fertility. So now we understand about what male fertility actually is. How do you find out? Now many men find out about male infertility when they've been trying to conceive for a couple of years, 18 months. They go to the doctor, they have a semen analysis, and that's the first time they find out, and that hits them really hard. One of the things I think we could do more of is home sperm testing. If you did that either at the beginning of your infertility journey, when you were having those early discussions to get a baseline, or 6 months in when you haven't successfully managed to conceive, that would give you more interest. It would allow you to look at the concentration and the motility of the sperm. So you've ruled out two of the key problems that could be there. And if you do it earlier, if you do actually have a problem with your sperm, then you can go to the GP, get a proper sperm analysis done, and you'll shave time off of your fertility journey, because if it's something that's treatable, they'll treat it. If it's something that is completely untreatable, then you can go for IVF. What can you do about male factor infertility? So treatment often depends upon the cause. And about 40% of male infertility has no cause, but is often attributed to lifestyle changes. So, I'm not going to sit here and preach to you. We all know that smoking's bad. We all know that major alcohol consumption all impacts it. But if we do try and stop smoking, reduce our alcohol consumption, eat a more healthy diet, try and lose a little bit of weight if we're overweight, or put on weight if we're underweight, all of those things are going to have an impact. Some of the specific things that I'd also think about doing is if you do suffer with a chronic condition or you take regular medication, then I get an appointment with your GP to talk about how those things might actually impact your fertility. You also want to look for ways to reduce your overall stress and anxiety. Now, I know work stress, life stress, those things can't be ruled out, but I just take a little bit of time out for rest and relaxation. I used to use the mindfulness app because my work could be very, very stressful at times. And what it did is it actually stopped me overthinking things and creating destructive thoughts. The final thing is just limit your heat exposure. As I said, I'm not saying never take a bath, but just moderate your baths, your jacuzzis, your saunas, those sort of things. So now we know how we can find out what it is, what are the treatment options. So as I said earlier, this is very, very specific to your own personal circumstances. So certain types of blockages can be treated with surgery. Certain types of hormonal balances can sometimes be treated with hormonal treatment. Infections can be treated with antibiotics if they're treatable. But other than those sort of main treatments, it's sort of using those above tips to work on your lifestyle choice. And then the final thing is, often those diagnosed with severe male factor infertility will be diagnosed for assisted reproduction treatments, and this is really, really common. So the sort of first line of assisted reproduction is artificial insemination. This is essentially where sperm is extracted, treated, and then it is used either to be inserted, so IVI, which is intervaginal insemination, where it's essentially just put into the vagina, or into uterine, where in a clinic it's fed past the cervix and directly into your uteral space. A 2004 study showed that if specific factors are taken into consideration, focusing on what type of male factor infertility there is, then couples can actually achieve a 28.1% chance of pregnancy by an IUI cycle, which is very, very close, if not in excess of natural conception rates. What it did say as well was that those with normal forms under 4%, and those with very, very low concentrations of those that fall out of progressive motility, so those sperm that move well, they're very unlikely to actually benefit from IUI, and they'll often be referred to the next stage, which is IVF. So IVF, which is in vitro fertilization, we have a video which I'll put in the card above about the IVF process, so we won't go into that into detail. But essentially, they take the egg, they take the sperm, they put it in a petri dish, they fertilise, and then they put the eggs back in the embryo and the blastocyst back into the lady. So, it's essentially just taking the process out of the body. If your male factor infertility is fairly severe, sometimes they'll suggest ICSI, intracytoplasmic sperm injection. Essentially, if they don't think that your sperm will be able to fertilise an egg naturally, they'll look at your sperm, they'll select a good quality sperm, they cut its tail off, they pick it up into a micro syringe and they inject it into the egg, and then the fertilisation takes place. There are some small additional risks with using ICSI, which is predominantly potential damage to the embryo because it is an invasive procedure. So ICSI is actually very common. In fact, about 28,000 of the 60,000 cycles that were done in 2017 used ICSI, so it's about 30% of IVF cycles do need to use ICSI. Now, some male factor infertility problems need surgical sperm extraction. This is if you are struggling to ejaculate or your ejaculate doesn't contain any sperm. Now, there are two types of these, which is PSA. This one essentially are fine needles put into the space just above your testicle, which is called the epididymis, and then it's extracted from there. This is really useful for when someone has obstructive no sperm, so when they don't have any sperm in their ejaculate, but it's to do with an obstruction. The next one is what you call TESA, and what they do is they make a slight incision in your testicle, and then they take biopsy from the tissue of your testicles, and this is when someone has a physiological problem whereby it's not to do with a blockage, so they've got no sperm being created but is not to do with a blockage. Then, final step in male factor infertility, if you have no sperm, there is no way for you to get sperm, or your sperm aren't of safe or good enough quality to fertilise an egg, you may have to look at using donor sperm. Often this is to do with DNA damage, or it can often be to do with inheritable diseases down the family line, and also some other sort of male factor issues. So many of the clinics actually have a list of donor sperm, and one of the things you can do is choose sperm from an individual who has similar characteristics to you, similar height, similar eye colour, similar hair colour. You don't have to, but some people like to match up their sort of genetic profile with someone else's. So I really hope this video has given you a short but sweet overview of male factor infertility, what it involves, what it does. I'm going to do some more videos on male factor infertility because I don't think the discussion is had enough about it, both within couples and more widely within the community and within society itself. So if you did like the content, give us a massive like and hit that subscribe button so that you can get more content.